A very good morning. Today we'll study about classification of malocclusion. So the last class it was about the occlusion. So we have studied about the basics of how occlusion should be, how a normal occlusion should be. So any discrepancy from the normal occlusion is the malocclusion, isn't it? So basically there are so many classifications of malocclusions given by so many authors. Basically it has the same thing, the basics is the same, but each author has given their own classification of malocclusion. So the widely accepted classification of malocclusion is, as always we will hear, isn't it, Angles classification. So that is the most widely accepted classification of malocclusion. So first I'll start with the introduction, like why we are studying the classification of malocclusion. So basically it is to understand a group of identities and to divide into groups and the subgroups based upon the similarities. So we should know what, in which criteria it comes, in which classification it comes. So each classification has its own identity and its own similarity, dissimilarities, and based upon that we can diagnose it, and we can again we have a different treatment plans according to that. Okay, so this various classification is given by different researchers. As I said before, like each researcher or each author has their own classification. So next one is the main thing, and understanding is for the communication. Like we'll say Angles class 1, it's like an identity. So Angles class 1, what is the for better communication, as we are dealing with all the dental terms, dental and the medical terms. So that is the first thing. Then is the, as I said, the most widely accepted classification is the angles given by Edward angle. So again, the Edward angle has its own modification, has its own disadvantages. So based upon the disadvantages, we have given so many modifications, again given by too many authors. So first, what is a dental occlusion? As it's taken in the last class, just a revision of this. Dental occlusion, it is a static and the dynamic interrelationship of both the maxilla and mandibular teeth that occurs during the mandibular movement. So that is basically what an occlusion means. So just I have revised this thing with anterior 6 keys to normal occlusions and how an occlusion should be and how a normal occlusion should be. So the key one is the molar relationship, as I said. As what Angles has given, like the mesiobuccal cusp, isn't it? The angle has given the mesiobuccal cusp of the maxillary first molar. It lies on the mesiobuccal groove of the mandibular first molar, isn't it? But Andrews has the same thing. The relationship is the same, but given in different terms, different sentence. Like the distal surface of the distal marginal ridge of the upper first permanent molar occludes with the mesial surface of the mesial marginal ridge of the lower second molar. So this is the term given by the Andrews, but basically it is the same given by the Angles and the Andrews. So again, just revising this thing, and crown and key 2, crown angulation, that is the mesiodistal tip, how the long axis of your crown is distally tipped when compared to the perpendicular of the crown. So then key 3 is the crown inclination, that is again it is the labiolingual or the buccolingual torque, how it is inclined, whether it is forwardly inclined or backwardly inclined or proclined or retroclined. So that is the again key 3. And the key 4 is the absence of rotation. There should not be any rotations, and there should proper interproximal contact between all the teeth. And the flat curvous peak, that is the curvous peak should be flat or slightly concave. So this is again to achieve the proper functional occlusion. And again the 7th keys has been added to the anterior 6 keys to normal occlusion is the Bolton's discrepancy. So just a revision about this, and this is an article given like criteria for an ideal occlusion, like functional occlusion in orthodontics, that is teeth should reach the maximum intercuspation, and occlusion stress upon the posterior teeth should be along its long axis. The posterior teeth should contact equally and evenly in occlusion. Then there should be minimal overjet and effective overbite, and the minimal amount of interference of the teeth. So these are the criteria should be advocated for the functional occlusion in orthodontics. So basically now comes to the topic like classification of malocclusion. That is, what is a malocclusion? As a condition where there is a discrepancy from the normal relationship. That is, any discrepancy or any difference from the line of occlusion is the malocclusion. So that is basically what a malocclusion is. Again, the first, as I said, it is a widely accepted angle system of classification proposed by Edward H. Angle, and he has given in the dental or original publication is the Dental Cosmos in 1899. And here the main principle of the angles classification, these are the three keys. That is a maxillary first, permanent molar. He has taken the main key for the classification. Second thing is the line of occlusion. As I said in the before class, there is the line of occlusion. It is more different in both maxilla and the mandible. And the anterior posterior relationship of the dental arch, that is the sagittal relationship, how the maxilla, how the molars are placed, whether it is mesial anteriorly or posteriorly. So the sagittal relationship. So this is the three principles where the which is based upon the angles classification. So here comes here, as I said, the line of occlusion for the maxilla and the mandible. And the first class is the class 1 malocclusion. That is the class 1 malocclusion is the molar relation. As I said, the mesiobuccal cusp of the upper first molar, it should lie at the mesiobuccal groove of the lower permanent mandibular molar. So this is the angles class 1 malocclusion. Again, the canine relation, that is the canine relation, again the mesial slope. So this is the mesial slope, isn't it? The mesial slope of the maxillary canine should occlude with the distal slope of the mandibular canine. So this is the canine relationship. And again, the line of occlusion, it should, again, the class 1 max, we'll say that the normal occlusion is the class 1 molar relation and class 1 canine relation. But what is angles class 1 malocclusion is that means whether they have all this, the molar relation will be normal, class 1. The canine relation will be normal. It is again a class 1 canine. But it will definitely have other irregularities like crowding or spacing or rotation or any absence of a tooth, a missing teeth, or any interarch problem, that is the teeth bite, overbite, or the increased overjet and the crossbite. So these all it includes in the class 1 malocclusion. Okay, so the molar relation and the canine relation will be the same. That is, the mesiobuccal cusp of the first maxillary molar occludes in the mesiobuccal groove of lower first molar, and the canine relation again, the mesial slope is again occluding the distal slope of the mandibular canine. So again, the line of occlusion. So any discrepancy. So the only thing is the line of occlusion will be having a problem. That is, you have all the crowding. Crowding means this is crowding. That is, there is no space. There is a Bolton's discrepancy. Okay, so there is no space for the tooth to erupt, and there is an intra-arch problems, individual tooth irregularities, spacing. Again, there are space between the teeth, rotation, and the missing teeth. Okay, so next is the interarch problem like deep bite. So this is the deep bite means the vertical overlap. Okay, so deep bite is the vertical overlap how the maxillary and the mandibular anterior teeth. The vertical overlap is the deep bite. Again, open bite means there is no, the minimum, or as I said last classes, and with the minimum or the normal overjet and overbite is around 2 to 4 mm. Okay, so below this or the less deep bite is known as the open bite. And again, increased overjet. Overjet is the horizontal overlap. Horizontal overlap between the maxillary and the mandibular teeth. And again, the cross bite. Okay. So this is class 1. Again, so this is the picture. This is the crowding. See, there is the molar relation will be the same, but the line of occlusion is different, isn't it? You doesn't have a proper line of occlusion. Here you have the maxillary anterior crowding. Again, here there is a spacing. Okay, so this is again a class, again a malocclusion. And one more thing is the class 1 bimaxillary protrusion. So bimaxillary protrusion is this. What means your maxilla and the mandibular anterior teeth will be forwardly placed. Okay, the teeth or the line of occlusion will be normal molar relation will be normal, canine relation will be normal, even the premolar will be normal. But the only problem or the only malocclusion is the proclination or the protrusion. Both the jaws are protruded, the maxillary and the mandibular. So there you have your edge to edge. There is no proper overjet and overbite. Rather, you will have an edge to edge contact. So this is called as the class 1 bimaxillary protrusion. Okay, so see, the key of occlusion and the line of occlusion is not at all altered, but only thing is the anterior, upper and lower anteriors are proclined, and you will have an edge to edge relationship. So this is what the class 1 bimaxillary protrusion. Next comes the class 2. So angles have class 1, then class 2. So class 2 malocclusion, again in class 1 you will have your mesiobuccal cusp. In class 2, it is the pistobuccal cusp of the maxillary molar lies in the mesiobuccal groove of the lower first molar. So this is the class 2 malocclusion. Okay. Canine, again, the opposite of the class 1. The distal slope is occluding at the mesial slope of the lower canine. And again, the line of occlusion. So normally this is have a proclined, this picture you can see, isn't it? You have your forwardly or proclined anteriors, maxillary anteriors. So here you will have a V-shaped arch or a constricted. I think I have a picture. Yeah. So here you can see in this picture, see, you have the arch is around V-shaped, isn't it? This is the V-shaped arch. So you have your V-shaped maxillary arch. Okay. And constricted, again, this you doesn't have a proper inter-arch distance. So you can have a narrow maxillary arch, and the space is very minimal. So this is called as the constricted maxillary. It is not, the normal is U shape, isn't it? So rather here you have a V shape, and again you have a constricted arch, and again you have a lip trap. Can see here, isn't it? So when you have an proclined anteriors, maxillary anteriors, definitely your lower lip will be, again it is encased or it is trapped between the maxillary anteriors. Okay, so that is called as the lip trap. So this is again malocclusion, and again very much deep bite. So if you are proclined, you have your maxillary anteriors proclined, so definitely you will have an increased overjet. Okay, increased overjet, and again you have an increased deep bite. So this is the class 2 division 1, and division 2 is the your opposite of this class 1, that is where anteriors are retroclined. Okay, so anteriors are retroclined, that is your class molar relation, and the canine relations are class 2, but the line of, again the line of occlusion is altered, that is you have your retroclined anteriors. So that is the class 1 and class 2 malocclusion. So class 2 malocclusion has class 1, division 1 and division 2. Okay, and again you have the classification as class 3. Okay, so that will continue at the next class. So basically in the class 1 canine relation, you will have your angles classification, you will have your class 1 malocclusion, then that is here thing, then the class 1 bimaxillary protrusion, and the class 2 again division 1 and division 2. Okay, so the next is will continue in the next class. Okay, thank you.